Good afternoon, everybody. Yeah, I was born and brought up here. It's a very nice nostalgia for me. And I studied in KEM Hospital, did my MBBS, MD and nephrology. And of course, my favorite colleague is Umesh Khanna, who has given an excellent presentation. So it's going to be difficult to challenge that. And yeah. There is no question about the need to reduce salt intake in the population. In 2023, the WHO issued a warning that the countries have deviated from their policy because of the COVID. And last 3 years, they have deviated from handling the non-communicable disease to COVID, and the emphasis on salt reduction had gone down tremendously. So you would realize that only 5% of the member states were having some sort of a salt reduction program. This was a drastic drop from the previous implementation. Yeah. So if you look at sodium reduction policies, if you talk of strategies, what are the strategies? Basically, the mantra is reformulation, reformulation, and reformulation. At home, you have to reformulate your diet, prepare with less salt. If you look at food which is consumed outside or a mass scale administration like the midday school meal or eating in a restaurant, everywhere the food has to be reformulated with maybe herbs or spices or whatever way to reduce again the salt intake. And thirdly, the food manufacturer. The food manufacturer again has to reformulate the ways of preservation. Salt is basically a preservative. So it was used as a preservative right from ancient times. That's why, as you said rightly, it was the salary. Because if you don't add something, salt, it would rot. So you require salt. But now preservation technology has improved. So companies have to change, reformulate the foodstuff so that the salt intake is reduced. Now WHO has a package to it. First and foremost, it's a shake package, the surveillance. So you have to monitor the salt intake of the population, which is done rightly, as rightly mentioned, the 24 hours urine sodium. So in a steady state, whatever salt you take in is removed only by the kidneys. What is removed in sweat or in feces is very low. That's why somebody can't cheat you. You ask a patient, he always tells me I eat less salt. When I do his 24 hours sodium, I find that it is much higher. So what he says is not right. So 24 hours. So you require to have a monitoring mechanism or a surveillance. The industry promotes the reformulation. Very important, as I told you. Labeling. I'll go a little later on the details of labeling of foodstuff and the knowledge to educate people, and of course the environment, availability of low salt substitutes. So the NMAP has given again the strategies in India. If you see it, I just can't agree in the sense, it says 30% reduction in the salt intake by 2025. This is not going to happen. I have been fighting since last 2010. It's very difficult to create knowledge. Even now, as I told you some time back, a cardiologist gives an advice without mentioning about reduction in salt intake. That's the level of awareness amongst doctors. Imagine the lay public. So we have to educate physicians, we have to educate the lay people, we have to give them salt reduced options. We have to have so many implementation. By 2025, it is impossible. The right figure would be about 10 years. About 10 years, I think we should be able to achieve 30% of the salt intake reduction. So several ministries are involved with it. As you know, the Department of Revenue Finance, for which can increase the tax. This is a suggestion that how you increase the tax on alcohol, smoking, same way you can increase tax on salt. This is not going to happen. It's not an easy by any chance. Of course, school education, where midday meal schemes, broadcasting, creating awareness, Ministry of Women and Child Development, Ministry of Railways. Ministry of Railways, I should mention. It's a very interesting thing. Large population of this country travel by train and they eat food. Very interestingly, in 2020 when COVID epidemic came, there was a news item saying that the Railway Ministry is going to serve preserved food now and not serve fresh food. That because of COVID transmissions, we would have the fresh food stopped and only packed food should be served. That would mean that the salt intake would go up. Fortunately, through a contact of ours, we could write to the ministry, railway minister at that time, that this should not happen. Fresh food should continue to be served. And I should kudos to the main railway ministry. They said they would continue to serve fresh food. So anywhere in the railway station, you still get idli, vada, sambar and other things. And it's not just preserved food of noodles and pastas and other stuff. So which contains much more salt than fresh food that is there. So of course, the Department of Biotechnology, which is involved in research, the Food Processing Department, which is concerned with the food labels. What are the ways in which you could probably eat less salt at home? So extend the life of cooking salt. Say if you are going to buy X quantity for 1 month, make the same quantity last for 2 months. See whether you can do that. Minimize eating high sodium foods, pickles, papads, and such things are in our diet. And of course, use high herbal preparations. Use herbs and other condiments, spices. Use fresh food. Use low salt substitutes, etc. They are all there. Already somebody has spoken about Raj Bhandari about the monosodium glutamate, which could be a good substitute to salt. But the normal low salt substitutes we have in the next lecture are all potassium chloride that is added to sodium chloride. So how do we reduce the salt intake from 12 grams to 5 grams? So it's very clear. Cooking salt, reduce at home. Sauces, avoid salted foods, pickles. This should be 60%. Food industry. So food industry has to reduce salt consumption. I'll go a little later how they can reduce. This has happened in the UK where the food industry has brought down the salt intake in bread. Public health campaign. Educate the public that salt is a chronic poison. It's a slow poison. You know about slow poison, same thing. Over years it kills you. So it doesn't, you may not get it overnight, but a friend of mine told me that I'm sure some of you would have seen the advertisement, eat pistachio for healthy living. This ad is coming in several newspapers and all these pistachios are salted. A friend of mine, colleague from IIT, told me that he took it for 2 weeks and his blood pressure went up. Then I looked up the medical literature. There is a recent publication that even short-term increase in salt intake can result in hypertension. So use less salt and avoid salted products. Schools and communities, very important, that you should start at an early age. That in children in UK, in school food, the food is served without salt. So this is a very important lesson we should learn. And this effect would last for years, both in the habit as well as in the long term. Like what I was surprised when I saw the slide showed by Vijay Kher, that if you have reduced salt in the first year of life, the effect is going to persist for so many years. Continuous TV, radio, internet, media, etc. So how do we do this reformulation? You cannot reduce this salt content overnight. What you do is, you gradually do it. So if you do it gradually, for example, if you reduce the salt every year by 5%, automatically at the end of 5 years you have reduced by 25%, but still the taste looks the same. It's a habit. So most effective is incrementally, you should reduce reformulation of foods. The typical example again is UK. I'll just show it a little later. Labeling. Labeling is very important. You should have, it's very unfortunate that in India, sodium labeling is still not mandatory. So you could see while coming in the flight also, I saw some of the items, there is no mention of sodium at all. There is a mention of fat, proteins, calories, but not sodium. So sodium labeling has to be made mandatory, and the print, the label should be large. It's very difficult to read these prints in the labels. You really require a lens, or somebody suggested you take a picture with your cell phone and then expand it to read what it is there. Tax on salt, I don't think is a practical approach. Avoid processed food and eating out, very difficult. I am sure with both the husband and working and the family very busy, you don't have time to cook. So you have to eat outside at least a couple of days in a week or more. People who eat at working places almost every day. So you cannot avoid this. But still processed food, you can eat a fresh food so far as possible. This is what I mentioned about labeling. So what you should have the labeling like what you have it in UK. Have a signal labeling. Somebody doesn't know, even a doctor doesn't know how much salt to take. You can't expect a layman to know how much salt to take. That I have to take 5 grams. How can he calculate? This is not possible. Put a signal labeling. Green means it's low salt. Yellow means borderline. Red means dangerous. For salt, for trans fat, as well as for sugar. So this is the signal labeling in the UK. This is very useful. So just take a product, have a look at it. It's green for your salt, whatever fat, or for your sugar. Accordingly you can choose it. So labeling has to come. This is the label I took from a popular blend in Chennai. There is no mention of sodium. As you will see, energy, protein, carbohydrate, sugar, fiber. No mention of sodium at all. And while coming in the flight, I saw the Indian bread has 490 milligrams per 100 grams of bread. Whereas in the UK, the limit is 230 milligrams per 100 gram of blood. We are eating a bread which contains double the salt that what is there in UK. These are the salt substitutes that are available anywhere in the world. You go Lay's, except India, in all the countries, including Sri Lanka and Bangladesh, gives you a low salt substitute of Lay chips. But in India, the low salt variety is not available. You are not given a choice. You go to the supermarket, there is only one type available for you. You are not given a choice. You go to the UK, you go any country, you will find the different choice. Lay's will give you every salted nuts, unsalted nuts, all choices are available. This is what we are selling in Chennai. This is a venture from our foundation. The Vandy's supplies low salt, makhana, snacks. This is now kept in a chain of stores called Nuts and Spices. I don't know whether they are present in the rest of the country. So Chennai has nuts and spices. This particular snack is available in all the this thing. The only problem is the shelf life of this product is less compared to the normal one. That's why possibly the food industry is not interested in reducing the salt intake. They want the shelf life to be 6 months. They don't want 4 weeks. They don't want 2 weeks. They don't want 1 month. They want it to last for 6 months. Whereas this will go for about a month safely, even up to 3 months. This we are selling it in the Chennai. So hidden salt. What is hidden salt? People are not aware. So hidden salt is in processed or packed foods. Food industry slowly reduced. No rejection by public. This happened in the UK. It's fantastic for public health. Very little cost. No cost at all. You just reduce and you are going to prevent vascular disease. It's not just blood pressure. See, salt damages the endothelium. So even if the blood pressure doesn't go up, you can still get heart attack, stroke or kidney failure. So it's very important to reduce your salt intake. So this is what UK did it. It set a target every year. So every 2 years. This should be the target. Say 2010, what should be the target? They brought it down to 1.1. 2012, they brought it to 1. And in 2017 to 0.9. Every year they were progressively reducing the salt intake. The Englishman's staple diet is bread. Breakfast bread, lunch bread, dinner bread. So they brought down the salt in the bread content. So you will see what started in 2001 at 1.2 dropped to almost 0.9 by 2011. So incrementally they brought it down and nobody knew. This I did in my own club in Madras. So what I did was, we told the chef, we have our own bread prepared. Don't reduce the salt intake by 10%, don't tell anybody. So the salt was reduced, it was not labeled. Nobody knew, nobody complained. So after another 6 months, we reduced by another 10%. 6 months over, nobody complained. So nobody comes to know if you progressively reduce the salt intake. If you suddenly tell a fellow to reduce salt, he is upset. So you will find the drastic drop in deaths because of the reduction in salt intake in the UK from 2003 to 2011. IHD's strokes. It corresponded to the blood pressure drop. It corresponded to the salt intake. Finland. Somebody mentioned. Finland are the world leaders. They started very early. They started in 1972 itself. They introduced, because they were taking 14 grams of salt and they had the highest incidence of strokes and heart attacks. And they produced it and they showed that there is a drastic drop by 2002 in both strokes and heart attacks. Same thing happened in Japan. The north of Japan were taking more than almost 14 grams of salt per day. And Japanese are known for their smoking at that time. And in spite of continuing their smoking, just reduction in salt resulted in reduction in stroke mortality. So Japan had the highest incidence of stroke. So worldwide action. 64 countries have an action plan for reducing salt intake. India also has now one, and India is labeled as, say, 2 out of 4, our score in the packet. And you will find several countries have legislation for restricting salt intake. Some of them are voluntary. So where you have to, so the New York mayor had a good program. He said the menu card should contain, like spice, green for vegan or vegetarian, there should be one for salt. He said put a red one with a square. This is high salt intake. You are eating at your risk. This is what we have been doing it in using a program for avoid the salt shaker. In Chennai restaurants, we approached all the restaurants. We told them don't keep the salt shaker on the table. If somebody is asking for his poison, he can ask for it. But don't serve it on the table. And believe me, see, normally what happens if you keep the salt shaker, the soup is ordered. Nobody tastes it even. They go on talking, they go on adding it because it's free. And then they eat it. So get rid of the salt shaker from your table. Singapore has a program, very strong program now after COVID. They have said that you should reduce the salt intake. This is the recent publication in the Lancet from Thailand. This is a program, again, I think RTSL has been involved with it, and where we can learn from their experience. And they have produced tremendous achievements in the low salt and the lessons that we have learned. I don't want to go into the details because of the shortage of time. If I start talking on salt, I go on for hours. That's the problem with me. So anyhow, we'll cut it short, but we can learn a lot from Thailand's program, which is published in Lancet. This is the letter we wrote to 300 food manufacturers in the country, asking them to reduce the salt intake. And believe me, only 2 companies responded to us, Hindustan Levers and Nestle. Hindustan Lever said that they already have a program and they are going to reduce the salt intake in this country, in India. And Nestle brought down the salt intake in noodles. Instant noodles of Nestle, the salt content has been reduced in the last 2 years. Same way in Kurkure, the salt content has been reduced by 15%. This is a very favorite snack eaten by children. We have several such posters where we have VIPs talking about it, that they have, this is a famous cinema actor in the south, Jiva, so he says he has cut his salt. That's a dramatist again who is a playwright who is very famous. Of course, Shatrughan Sinha, you will know. The one of the posters, 5 ways to bring down to 5 grams. And the myths, as Vijay Kair has already spoken about it, that sweat contains a lot of salt and if you sweat, you should take more salt, which is not true. It's a hypotonic substance. Once you are acclimatized, the salt content of sweat is as low as 10 milliequivalents per liter. Where is 140 in the blood and where is 10? So if you are acclimatized, if you are not acclimatized, you can lose a little more salt. Then in fact, children, some unfortunate thing in India, they think that children require salt. The grandmother starts with dal, rice and ghee and salt right in the first year of life, which is a very harmful thing to do. So children don't require salt at all in the first year of life. We should follow UK. The whole school food is served without salt. So, but only by the age of 12, you should reach the adult requirement of 5 grams of salt per day. So it has to be gradually done. This is our favorite poster. You could see that apes. The apes in the jungle, the blood pressure is 90/60. Admit, put them in the New York Zoo and give the human food, the blood pressure goes to 140/90. So this is our favorite poster. And of course, as I said, we have several other posters where myths and facts. The bread slice. The blood slice limit is only 230 milligrams in 100 grams in the UK, whereas India is much higher. Get rid of the salt shaker. And of course, we have a number of videos on our website, lowsalted.org. I would be happy if you can become a member of it. We give you recent information about salt and health. And of course, we have several videos on it. And we involve with, important personalities. This is Venkaiah Naidu. When he was the Vice President of India, he spoke in a kidney conference. He just got up. I had given him some data about salt, so he spoke for 5 minutes on salt, which made a big impact. And we have streets place, which we take it to the socially poor people. We go to the hutments, have these street plays, and educate them, because people have a wrong idea that hypertension and diabetes are only disease of the rich. The poor also have, and they consume a lot of salt. Actually, the practice in South India is to use salt while cooking rice. So they don't like to eat raw rice cooked rice without salt. So the cooking itself, the salt is added. So in that way, they can avoid vegetables or anything. They just can eat rice. So the mantra again, as I said, is formulating foods to contain less salt, setting targets for the amount of sodium in food and meals. Public procurement policies should limit sodium-rich foods like hospitals, schools, workplaces, nursing homes. One of the projects, fortunately, the Public Health Department of Tamil Nadu has been very helpful. We have had 2,000 physicians, Public Health Center physicians attending our meeting, and we are trying to get into the midday meal program and see whether we can introduce low salt in the midday meal for the school children. Front of package labeling that helps the consumer to select. Please give options. Please make clear labels. Red labels, signal labeling. Obviously, behavior changes in the population. We'll educate them. Can we? This is our popular video. Of course, he's talking in Tamil. You can only see what is written. He's talking about salt for 2 minutes.
சரி ஒரு குக்கு நம்ம வீட்டுக்கு வந்துட்டாங்க. சூப்பராக சமைக்கிறாங்க, செம்ம டேஸ்ட். இப்படியே சாப்பிட்டுட்டு இருக்கோம். பட் 2 பேருக்கும் பிபி ஏறிட்டே இருக்கு. என்னடான்னு பார்க்குறோம், டாக்டர் இதெல்லாம் டெஸ்ட் பண்ணுறோம். என்ன பார்த்தோம்னா பிபி என்னடா இது, பிபி ஏறிட்டு இருக்கு, 2 பேருக்கு ஏறிட்டே இருக்கு. அதுக்கப்புறம் ஒரு ஃப்ரெண்டு, நம்ம நல்ல ஃப்ரெண்டு வந்திருக்காங்க. அவங்கள சாப்பாடு வீட்டில் கூப்பிட்டுருந்தேன். ஸோ சாப்பாடை சாப்பிட்டு எப்படி இருக்கு சாப்பாடுன்னு சொன்னால் மற்றவங்களும் சாப்பிட்டுருக்காங்க. பட் உப்பு ஜாஸ்தியாக இருக்கு, ஆயில் ஜாஸ்தியாக இருக்கு அப்படின்னு சொல்ல முடியாது. இல்லை நல்லா இருக்கு சொல்லிட்டு அப்புறம் பேசிக்குவாங்க. எங்கள் ஃப்ரெண்டு மூஞ்சி மேலேயே சொல்லிட்டாங்க, ஏன்னா இவ்வளோ உப்பு இருக்கு, இவ்வளோ ஆயில் இருக்கு, எப்படி சாப்பிட்றீங்க அப்படி சொல்லி இப்படி வருஷக்கணக்காக சாப்பிட்டுட்டு இருக்கோம் நம்ம. அதுக்கப்புறம் உடனே கூப்பிட்டு அது சேஞ்ச் பண்ணி அதுக்கப்புறம் தான் பிபிஎல்லாம் கம்மியாச்சு. ஸோ அந்த மாதிரி சமையல் பண்ணிருக்கும் போது நீங்களே உப்பு அதை பழகிட்டு அந்த பழகின பிறகு இப்படிதான் விஷயங்கள் இருக்கும். மற்றவங்களுக்கு அப்போதான் தெரியும்.
Yeah. Thank you.